Good evening. It's day 12 of my endometriosis diary. Tonight I want to talk about how I was diagnosed with endometriosis. So where to start? It's hard to know where to start because I don't want to go back in too much detail, or if you want to know about all the gritty details, then ask me to go back further and and I'll see what my drug-addled mind can remember. So, endometriosis diagnosis happened in 2017, after having surgery, after having a hysterectomy. The reason that I had a hysterectomy, so I'll go back a little bit. So for years and years, I've struggled with painful periods, debilitating periods that have meant that I've had to spend days in bed and crippled up in pain and stuff, and have been going to doctors repeatedly for period issues and for stomach issues, and not really been taken particularly seriously, as is the case for a lot of women with this condition. But eventually, I went to a doctor. I found a doctor, just a GP, and she was really good. She listened to me first of all, and asked me what I wanted to do. So once she'd listened to what my issues were, and my issues when I first went were not just the pain of having periods, but it was the hormones by that point as well. The hormonal ups and downs had got so acute that it was hard to function for a lot of the month. I'd get up to 2 weeks of feeling hormonal, just feeling incredibly unbalanced and not like myself, and then 2 weeks in, then I'd start bleeding, so I'd have a really, really painful period. So I was getting a week, sometimes less, in a month, and my cycles varied between 26 days to 28 days. Every now and again I'd get a 30-day cycle, but that was pretty rare. Most commonly it was 26 to 28 day cycle, and I'd get a week of feeling alright within that. And this doctor really listened to me, and she gave me some options about what I might like to do, and most of those options involved contraception. I mean, we talked about pregnancy, and she talked to, I think Bez came to one of the appointments as well, and we talked about how we'd been trying to have children for 8 years, and it hadn't been happening. So what drugs, what contraceptions might be possible to take that might alleviate some of the symptoms of bad periods and these hormonal things, to try and track it down, what exactly was going on with me. So I tried taking the the pill. I think I took it for about 8 months or something like that. I took jasmine combination pill, I think it was, and it alleviated some of the pain and stuff, because obviously you're only bleeding every 3 weeks, but then when the 3-week cycle would come for me to bleed for a week, then it was pretty horrendous. There wasn't a great deal less pain, and there was a lot of blood and discomfort. So, and then gradually, and it kind of helped with the hormones a little bit, but not massively, to be honest. I still felt pretty unbalanced and had other side effects from taking the pill as well, which I can't remember all of now, to be honest with you. So I stopped taking that, and and later on I was getting spotting and things as well. So I stopped taking the pill, and she asked if I wanted to have the coil, the Mirena coil, because some women with trouble with their periods have the Mirena coil, and it can help. But I didn't want to do that. So I said to her, what I really want to do is I want a referral to see an endometriosis specialist, because I had some suspicions that I had endometriosis by this point. You know, I've said before that quite a few friends of mine had suggested that it was something that I had, and I'd kind of dismissed it out of hand because I felt like my periods weren't painful enough to be endometriosis. You know, just thinking that I was a wuss or whatever, that I was a pain wuss, and I couldn't cope with the amount of pain of a period, and that it was normal, but everybody else, you know, didn't. Yeah, they just weren't as wussy about pain as I was. So yeah. Yeah, I got referred to a gynaecologist. I got a choice of a few different gynecologists, and Bez and I looked together at specialists in the area, and we were actually one of the choices was to go to a specialist in Elland. And they were very well recognised as an endometriosis specialist in this country. So it's pretty lucky. It's only like 9 miles away from where we live. So then the next stage was to get this appointment with the specialist and go and see her. Yeah, it was a revelation. But I'm going to talk about the revelation tomorrow and leave it on a cliffhanger, because that's already 7 minutes in. So I will continue the story tomorrow. Good night, listeners.